Let's see some pictures. First off, this is in RBCs seen on light microscopy. These are dysmorphic RBCs with fragmentation and budding, usually seen in glomerulonephritis due to the RBC squeezing through the inflamed GBM. And then here we see a cellular cast, and here we see the eosinophils and suspected allergic nephritis. Here we see a muddy brown RBC cast. Sorry, this muddy brown cast of ATN. This one in particular is due to phosphocarnate nephrotoxicity. And then here we see the calcium oxalate crystals, envelope shaped calcium oxalate dihydrate, and needle shaped or calcium oxalate monohydrate, seen in ethylene glycol poisoning. And then here we see the calcium phosphate or brushite crystals, asymmetric rod-shaped aggregate of calcium phosphate brushite crystals intermingled with calcium oxalate dihydrate crystals, seen in hypercalciuria and hyperoxaluria. And then here again we see urate or uric acid crystals, rosette or rhomboid shape crystals of uric acid used in pink urine, seen in pink urine after recurrent seizures, after propofol anesthesia, when the uric acid is super high, after tissue breakdown, and also seen in heat stress related Mesoamerican nephropathy. And then here we see the sulfuric crystals, shock of wheat appearance of sulfamethoxazole crystals seen in acute kidney injury following high-dose sulfamethoxazole trimethoprim or Septra therapy. And then here we see a triple phosphate struvite crystals, which is a coffin lid shaped ammonium magnesium phosphate crystals seen in infected alkaline urine. And then here we see the cystine crystals, hexagonal crystals, and the stone formers with cystinuria. I think this was this one. This is a cystine stone. And then these are acyclovir crystals, needle-shaped acyclovir crystals seen in acute valprocyclovir overdose in AKI. And then we come to the renal pathology images. These are light microscopy. We see the mesangial proliferative GN and H&E staining. Here we see endocapillary proliferative GN. Here we see the crescentic GN with fibrinoid necrosis this year. And then this is MPGN. This is immune thrombi intraglobinemic glomerulonephritis PAS stain. Here we see FSGS, not otherwise specified type of PAS staining. Here we see FSGS tip lesion. Here we see the collapsing variant of FSGS nodule, mesangial sclerosis, PS positive, and then acute thrombotic microangiopathy in glomerulus and H&E. Right here, you can see these red, I think RBCs, and then acute tubular necrosis with PS staining. We can see that all the tubular cells are necrosed and atrophied. And then acute interstitial nephritis, PS staining. You can see a lot of these interstitial infiltration. And then here we see strongly birefringent calcium oxalate crystals, polarized light, atypical cast of myeloma, light chain nephropathy inside the tubules. And then here we see glomerular granulomatous interstitial nephritis and past staining, mucoid intimal edema of medium caliber artery scleroderma crisis. Here we see cholesterol emboli right here in a large artery, granular mesangial staining This is IF in IgA nephropathy. And then this is granular mesangial and capillary subendothelial staining in MPGN. This is granular subepithelial staining in membranous. So this is subendothelial, this is subepithelial. This is starry sky appearance in glomerulonephritis. And then linear staining in N2GBM, this right here. And this one is smudgy mesangial staining in amyloidosis. And here, immune deposition disease. And then here, subendothelial electron deposits. And here, subepithelial electron deposits. Here we see dense deposit disease. Here it is amyloid fibrils 8 to 10 nanometers. And these are fibrillary deposits, which are a little larger with 16 to 20 nanometers. And then really large fibrils in immunotactoid of 30 to 50 nanometers. And then we can see annular tubular substructure in cryoglobulinic GN here. And then endothelial tubular reticular inclusions, usually the interferons, or sometimes associated with viral diseases and autoimmune diseases, for example, lupus. And then subepithelial humps are these, and then myeloid bodies in podocyte or Fabry disease, so-called thumbprinting, or maybe zebra bodies as well. And then diffuse podocyte foot process effacement, usually in minimal chain disease. And then this is GBM, lamellation in hereditary nephritis with basket weaving here. Radiological images, we see hydronephrosis right here. Note the dilatation of the renal pelvis, replacing the view of the medullary sinus fat. Hydronephrosis is differentiated from dilated renal veins by having the negative Doppler and having the branching pattern into the renal calyces. Here we see a small echogenic kidney consistent with CKD and with a large cortical cyst right here. And then this is a kidney stone. You can see the echogenic structure with the posterior shadowing on the parenchymal medullary border. Notice the dark shadows from the upper and lower pole of the kidney, which are normal edge shadowing artifact. And this is a lung, normal lung with two ribs with posterior shadowing, pleura, and a line at 8 centimeters, a line at the 8 centimeter depth, this right here. And then overloaded lung with multiple B lines originating from the pleural line, extending to the end of the screen and without A lines through it, right here, like a spotlight. And then at the end is non-distended bladder around the Foley's, echogenic Foley's balloon shaped fluid with consistent with the size. So this is the site is not bladder, and bladder is right here, and inside the bladder you can see the catheter. So here we come to an end to this review of pictures in nephrology.